So, doctor, we're talking about flu stats, prevention. It's that time of year.
It is.
So, how is the current flu season shaping up right now?
Well, we just came off of probably one of the worst flu seasons on record, on recent record, last flu season. This year, as with many years, we're starting to peak in many areas, but the season definitely doesn't appear to be quite as severe as last year. The predominant virus strain is H1N1, which tends to be a little bit milder, and the flu vaccine seems to be a much better match this year than it was last year.
So, what's our time frame from month to month of flu season?
So typically, flu can happen any time of the year, but the majority of cases happen between November and April, and so we're kind of right in the middle. Peaks are usually sometime January, early February, so we're right there right now.
Got it. So what's the best way to prepare for the flu season, and what can people do if they contract the flu this season?
Yeah. So the best thing that people can do to prevent getting the flu is to get the flu shot. It's very effective. It's super safe for patients to get, and it's not too late to get it. So if you haven't gotten your flu shot, now's the time. Anyone that's greater than 6 months of age can safely get the flu shot. If you do get sick and think you may have the flu, it's important to give a call in to your doctor, especially early on after you get sick. It's best to call them within the first 1 or 2 days, because that's when the flu drugs are most effective.
Got it. So can you give us an example of what the flu entails? There's different strains and there's different, people consider the flu.
Yeah, a lot of people call a lot of things flu, but really true influenza is something that makes people sick very, very quickly. They can be healthy 1 minute and then get very sick the next. They typically have high fevers, severe body aches, and cough. It's mostly a respiratory illness, so if it's something that's not respiratory, it may not be the flu, although you can sometimes get other symptoms. It's mostly a respiratory illness.
So why are antiviral medicines important for the treatment of the flu?
Yeah. Well, again, as we learned last year, some people can get very sick with the flu, and antivirals can help reduce the severity of illness. The currently available drugs that we have to treat the flu shorten the duration of illness pretty significantly, at least a day reduction for most patients, and can help prevent complications for patients that have the flu, I should say.
So are these new?
There is one new flu drug this year that has a new mechanism of action. It's called Xofluza or baloxavir, and I'm really lucky to be working with Genentech to help people understand about some of these newer agents.
Great. So where can our listeners go for more information?
So the best place to go is to Xofluza.com, XOFLUZA.com.
Now, is there anything we didn't cover in this interview that you would like to mention yet?
I think just to reiterate, if you haven't gotten the flu shot, get the flu shot. And if you feel like you're sick, call your doctor right away, because there's lots of therapies, including Xofluza, that patients can get to help shorten the duration of illness.
Great. Well, thank you for your time.
You're welcome. Have a great day.